Hi all, today we are going to discuss about the anticoagulants for CPB. In that, we have to discuss about, first of all, about coagulation. Coagulation is a complex process by which blood changes from a liquid to a gel form. That means the clot. It is an important part of hemostasis. The mechanism of coagulation includes platelet activation to seal a damaged blood vessel wall and clotting factors responding to form fibrin, which strengthen the platelet plug and begin the repair of the damaged vessel. There are two ways of fibrin formation. One is extrinsic pathway and another is intrinsic pathway. Extrinsic pathway is otherwise known as the tissue factor pathway and intrinsic pathway is otherwise known as the contact activation pathway. The extensive pathway begins with trauma tissues outside the blood vessels, whereas intrinsic pathway begins with trauma to the blood itself when it comes into contact with the damaged or roughened vessels. Then both the pathways result in the activation of both factor X and then converts prothrombin to thrombin with the help from factor 10A. The thrombin converts fibrinogen to first soluble fibrin and which is then made insoluble by the activation of factor 30. Heparin. Heparin is an anticoagulant discovered in 1916. It was isolated from the liver cells. It has got the name heparin from the Greek word hepar, which means liver. The commercial heparin most often derived from pig's intestinal mucosa and it is known as porcine mucosal heparin and lung heparin from cattle lung, bovine lung heparin. Both bovine lung heparin and porcine intestinal heparin have been widely used as anticoagulants for CPB. Heparin is a compound of highly sulfated polysaccharide located in mast cells and has a highest negative charge density and it is strongly acidic and an injectable anticoagulant. Heparin was widely used in cardiopulmonary bypass because of its clinical effectiveness and it is rapid and can be rapidly neutralized by protamine. And the mechanism of action of heparin is to prevent thrombin formation by increasing the activity of the antithrombin factor 3 present in blood. To inhibit it actually works as to inhibit the transformation of prothrombin to thrombin through inhibition of factor 2A and 10A. Antithrombin 3 factor is a glycoprotein found in plasma. Heparin binding with 83 leads to increase in the ability of 83 to inhibit thrombin to 1000 times or more. Longer heparin chains inhibit 2A and 10A, whereas shorter heparin chains preferentially inhibit 10A. In this diagram, we can see that the longer heparin chains inhibit both the factor 10A and 2A, whereas the shorter chains inhibit factor 10A only. Heparin is also associated with second helper factor or cofactor 2. Cofactor 2 is a glycoprotein that can cause inhibition of thrombin independently of 83. This reaction occurs slowly and requires larger doses of heparin compared with 83. The heparin association of cofactor 2 is important for anticoagulation, especially in patients with 83 deficiency. In some patients having 83 deficiency, heparin bonds with cofactor 2 and activates its mechanism. Heparin dosing. Inadequate dosing of heparin leads to inadequate anticoagulation and the inadequate anticoagulation further leads to thrombosis, intravascular clotting, oxygenated dysfunction and consumption of clotting factor. The initial dose of heparin in an adult patient has been determined by the patient weight. In milligrams, it is calculated as an adult heparin dosage is equal to 3 into weight in kilogram. Patient weight it leads. For 83 concentration is in healthy newborns is only half than that of adult. So the heparin dosage for uh, adult pediatric cases is 4 into weight in kilogram or pediatric dosage 90 into BSA, body surface area. Extracorporeal circuit heparin doses forms 2000 to 3000 IU per liter of priming fluid or 1 mg per kilogram. Larger doses of heparin-induced platelet dysfunction, stimulation of tissue factor pathway inhibition, facilitation of fibrinolysis, increase in surgical bleeding, decrease in systemic vascular resistance, higher cardiopulmonary bypass, heparin concentration, predisposed to postoperative heparin rebound effect that requires treatment with additional protamine. Thank you.